Chapter 8. Addiction and Recovery. 8.1 Understanding Addiction, Historical and Modern Perspectives. Addiction is a complex condition characterized by compulsive substance use despite harmful consequences. Historically, societies have viewed addiction through various lenses, often shaped by cultural, religious, and social attitudes of the times. In ancient civilizations, drug use was largely integrated into religious ceremonies or healing practices, and addiction was not recognized as a distinct health issue. By the 19th century, as the medical field began to evolve, addiction started to be identified as a disease, challenging earlier perspectives that linked addictive behaviors primarily to moral weakness or a lack of willpower. In the early 20th century, with prohibition movements and a greater understanding of public health, the societal approach to addiction became more punitive, often criminalizing substance use disorders, SUDs. This period saw individuals with addictions being marginalized and stigmatized, with many being incarcerated rather than receiving treatment. During this era, addiction was primarily seen through a legal lens rather than a healthcare perspective, leading to policies that did little to address the root causes of addiction or provide pathways to recovery. By the mid-20th century, as psychological and medical knowledge expanded, addiction began to be viewed more as a chronic, relapsing disease that affected brain function and behavior. This period marked the development of the disease model of addiction, which posited that addiction was akin to other chronic illnesses like diabetes or hypertension. This shift in perspective laid the groundwork for more compassionate and therapeutic approaches to treatment and spurred the growth of peer support groups, such as Alcoholics Anonymous (AA), which became integral to many individuals' recovery journeys. The end of the 20th century and the onset of the 21st century brought significant advances in understanding the neurobiological underpinnings of addiction. Research has shown that drugs and alcohol can alter the brain's chemistry and circuitry, leading to changes in behavior, cognition, and emotional regulation. This has supported the disease model and encouraged the development of evidence-based practices in addiction treatment. The modern view of addiction encompasses genetic, environmental, and psychological factors, indicating that a multifactorial approach is necessary for effective treatment and recovery. Despite advancements in understanding addiction, stigma and misconceptions persist. Misinformation and societal prejudices can create barriers to treatment, often preventing individuals from seeking help. Efforts to combat stigma include public education campaigns, policy reform, and integrating addiction treatment more thoroughly within healthcare systems. It is crucial for societal attitudes to continue evolving to support individuals with SUDs, recognizing addiction as a treatable condition and emphasizing recovery as a realistic and attainable goal. Current research has also begun to explore the potential for personalized medicine in addiction treatment, acknowledging that different individuals may require different treatment strategies. Pharmacological interventions, such as medication-assisted treatment (MAT), have gained recognition for their effectiveness in treating certain addictions, such as opioid use disorder. MAT, combined with counseling and behavioral therapies, offers a comprehensive and individualized approach to treatment, which is the cornerstone of modern addiction medicine. Another modern perspective on addiction is the harm reduction model, which prioritizes reducing the negative consequences associated with drug use rather than solely focusing on abstinence. Harm reduction approaches can include needle exchange programs, supervised injection facilities, and the distribution of naloxone to reverse opioid overdoses. This model recognizes that complete abstinence may not be achievable or desired by all individuals with SUDs, and that minimizing harm is a valid and important goal. Recovery, the process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential, is a deeply individualized journey. Recovery is not a linear process, and it may involve multiple attempts before achieving long-term sobriety. Supportive networks, including healthcare professionals, peer support groups, and family members, play crucial roles in assisting individuals through their recovery. Although relapse can be a part of the recovery process, it should not be seen as a failure, but rather as an opportunity for learning and growth. Public policy continues to evolve in response to the ongoing challenges related to addiction. The creation of drug courts, increased funding for treatment programs, and insurance parity for mental health and SUDs are examples of how policies are changing to reflect a more nuanced understanding of addiction. These policy shifts aim to provide more supportive environments for individuals seeking recovery and establish a framework for early intervention and prevention efforts. Our understanding of addiction has transformed significantly from ancient times to the modern era. The historical view of addiction as a moral failing has been largely replaced by a recognition of the multifaceted nature of the disorder. Today, the approach to addiction is informed by scientific research, effective treatments, and a compassionate understanding of the individuals it affects. While there is still much to learn and societal attitudes continue to evolve, the current focus on holistic and personalized care offers hope and support to those on the path to recovery. Continuing education, research, and policy reform are essential to further improve the lives of individuals with SUDs and facilitate their journeys toward health and wellness. 8.2 Social support systems and drug recovery. Social support systems play a crucial role in the recovery process for individuals struggling with drug addiction. Recovering from addiction is often a complex journey fraught with challenges that range from physical withdrawal symptoms to psychological dependency. Social support can come from various sources including family, friends, professional counselors, support groups, and community networks. Each of these pillars can contribute to the sustenance and reinforcement of the individual's commitment to sobriety. Family support is often the cornerstone of the social support system for anyone dealing with addiction. Family members can provide emotional comfort, encourage adherence to treatment plans, and help to maintain a drug-free environment. For many recovering addicts, the family offers a sense of belonging and unconditional love, which is vital during the vulnerable times of recovery. Nevertheless, family dynamics can be complex, and not all family environments are supportive. In such cases, it's necessary to establish boundaries or seek support from external family therapy programs to foster a healthier relationship dynamic. Friends and peers contribute to the support system by offering companionship and understanding. Relationships with people who encourage healthy behaviors can motivate a person to remain committed to recovery. It's important for recovering individuals to be selective with their social circles, choosing friends who respect their decision to stay sober and abstain from substance use. Building friendships with others in recovery can be particularly beneficial, as they share a common goal and can empathize with the recovery experience. Professional counselors and therapists are trained to deal with the psychological aspects of addiction. They can provide personalized support, coping strategies, and therapeutic interventions to address the underlying causes of addiction. Therapy sessions aim to equip individuals with tools to handle stress, resolve personal issues, and ultimately change behaviors related to drug use. Consistent engagement with professional services is linked to better recovery outcomes and can substantially decrease the likelihood of relapse. Support groups such as Alcoholics Anonymous or Narcotics Anonymous offer a structured system of support where individuals in recovery can share their experiences in a non-judgmental and anonymous environment. These groups operate on the principle of shared experiences and mutual support, promoting the idea that individuals can help each other achieve and maintain sobriety. Participation in such groups also helps to reduce feelings of isolation, as members become part of a community that understands their struggle. Community networks provide additional layers of support that can be tailored to the needs of recovering individuals. This may include vocational training, legal assistance, housing programs, or educational opportunities. Such services help individuals reintegrate into society and improve their quality of life, which can positively influence their recovery journey. Additionally, community engagement fosters a sense of purpose and belonging, which is important for maintaining long-term recovery. Relapse prevention is a critical aspect of recovery, and social support systems play a vital role in this. They can help an individual recognize early signs of relapse, provide encouragement to stay on track, or offer assistance in getting back to a recovery program if a relapse occurs. A strong support system can make the difference between a minor setback and a complete return to substance use, underscoring the importance of having trusted individuals who are committed to the person's sobriety. Education about addiction is another key component of social support systems. Educating family members, friends, and the broader community about the nature of addiction reduces stigma and fosters empathy. It also allows the support system to better understand the recovery process and the challenges involved. Increased awareness can lead to more effective support and encourages a more inclusive environment for the recovering individual. Online social support has become increasingly relevant in the modern context. Digital platforms can connect individuals in recovery with peers, counselors, and supportive communities, regardless of geographical constraints. While online support should not replace face-to-face interaction, it can complement existing support structures and provide additional resources and points of contact for individuals seeking help or guidance. Spirituality or religious support can also be significant for some individuals in recovery. Many find strength and solace in their spiritual beliefs, which can provide a framework for understanding their journey and sustaining their commitment to recovery. Faith-based groups and spiritual counselors can offer personalized support that align with the individual's values and worldview. Finally, developing self-support skills is an indispensable part of utilizing social support systems effectively. This involves learning to seek help when needed, engaging actively in treatment programs, and understanding one's own role in recovery. It is essential for individuals in recovery to take responsibility for their journey while making use of the social resources available to them. Self-empowerment coupled with strong social support creates a robust foundation for lasting recovery. Overall, social support systems are integral to the process of drug recovery. They provide emotional security, practical assistance, and a framework of understanding and acceptance. These systems surround the recovering individual with a network of resources and relationships that reinforce positive behavior changes. Building and maintaining these support structures are key to reducing the risk of relapse and supporting a life free from addiction. 8.3 The psychology behind addiction. Addiction is a complex condition that does not arise from a singular cause, but rather from an intricate mesh of psychological factors. It involves the compulsive use of substances despite harmful consequences. Psychological processes, such as reinforcement and reward, learning and memory, stress responsiveness and decision-making, are all altered in the brain as addiction develops. Understanding these psychological underpinnings is crucial for both preventing and treating addiction. One core aspect of addiction is the brain's dopamine system, which plays a central role in the reward circuit. When a person uses a drug, it can cause a significant release of dopamine, far more than natural rewards like food or social interactions. This heightened level rewards the experience, creating a strong desire to repeat the drug-taking behavior. Over time, the brain may require more of the substance to achieve the same dopamine high, a phenomenon known as tolerance. Tolerance is not the only psychological transformation that occurs. There's also the concept of conditioning. Conditioning ties a drug with certain cues, environments, or emotions through a learning process known as classical conditioning. For instance, if someone consistently smokes in a particular room, the room itself becomes a cue that prompts the craving for a cigarette. These environmental and emotional cues can trigger intense cravings, particularly in individuals trying to abstain from drug use. In addition to the physical cues, cognitive and emotional factors also contribute to the psychology of addiction. Negative emotional states, such as anxiety or depression, can increase the propensity for drug use as a form of self-medication. This creates a vicious cycle where the substance temporarily numbs discomfort, but ultimately may worsen the underlying emotional state, reinforcing the need for the drug. The role of stress is another critical element in the psychology behind addiction. The body's stress response system is intended to manage acute threats or challenges. However, when engaged chronically, either by the stresses of life or the stress of withdrawal, it can lead to changes in the brain that make an individual more susceptible to addiction. Stress can impair the prefrontal cortex, the part of the brain responsible for decision-making and impulse control, making it more challenging to resist urges to take drugs. Decision-making processes are markedly affected in individuals with addiction. The prefrontal cortex, which evaluates the pros and cons of a decision, is often compromised. This impairment means that the long-term consequences of drug use are often largely discounted, leading to continued use despite harmful outcomes. Instant gratification is frequently prioritized over long-term benefits when the prefrontal cortex is not functioning optimally. The psychological concept of hedonic set point can also contribute to addiction. People typically have a baseline level of happiness, but substance use temporarily raises this baseline. Over time, the brain adjusts to the enhanced pleasure caused by drugs, which can lower the natural set point. Consequently, activities that used to provide satisfaction may no longer be pleasurable, and drugs become one of the few ways to surpass the lowered hedonic threshold. The role of genetics and personality traits in the psychology of addiction cannot be understated. Certain personality traits, such as high impulsivity or sensation-seeking, are associated with a higher risk of substance abuse. Likewise, genetic predispositions can influence how rewarding a person finds a drug and how susceptible they are to developing an addiction. While these factors might not cause addiction directly, they are influential in the overall risk profile for developing an addiction. Peer pressure and social context play a significant role in substance use and addiction. Human beings are inherently social creatures, and the desire to fit into a group can influence drug-taking behavior. This social aspect is particularly poignant during adolescence, when the opinion of peers greatly influences behavior. The initiation into drug use is often facilitated by social environments where drug use is normalized or encouraged. Recovery from addiction hinges on addressing the psychological factors that contribute to the substance use disorder. Effective treatment plans often include behavioral therapies that help retrain the brain, such as cognitive behavioral therapy, which focuses on altering dysfunctional thought patterns and behaviors. Another approach is contingency management, which uses the idea of reinforcement by giving rewards for sustained abstinence. These recovery strategies reflect a deep understanding of the psychology behind addiction. Understanding the psychology behind addiction provides the context that substance abuse is not a failure of character, but rather a medical condition influenced by a plethora of interlinked psychological factors. It highlights the importance of early intervention, compassionate treatment, and a comprehensive approach that encompasses the complex nature of addiction. This understanding is the bedrock of any effective prevention and treatment strategy. By focusing on the psychological aspects of addiction, there can be better outcomes for individuals struggling with substance use disorders. 8.4 Addiction treatment methods in different cultures. Addiction treatment varies widely across the world, reflecting cultural norms, spiritual beliefs, and medical practices. While some cultures favor medicalized approaches, others integrate traditional healing practices, community support systems, or religious rituals. This section explores how different cultures address addiction treatment and the impacts these methods have on recovery. In North America, addiction treatment often combines medical intervention with psychotherapy and counseling. This biomedical approach tends to focus on addiction as a chronic disease that can be managed but not cured. Treatment often starts with detoxification, using medication to manage withdrawal symptoms, followed by a variety of therapies, such as cognitive behavioral therapy, CBT, motivational interviewing, MI, and group therapy. 12-step programs like Alcoholics Anonymous, are also common, combining peer support with spiritual principles. In contrast, some European nations, like the Netherlands and Portugal, have progressive drug policies that emphasize harm reduction. These cultures view addiction primarily as a public health issue. Treatment approaches in these countries often include state-supported drug substitution programs and safe injection sites. Psychotherapy and social reintegration programs are integral, aiming to improve the quality of life for individuals with addiction and minimize the negative consequences associated with drug use. Traditional Chinese medicine, TCM, offers an example of a non-Western approach to addiction treatment. TCM typically views addiction as an imbalance in the body's vital energy, or qi. Treatments often involve acupuncture, herbal medicine, and Tai Chi. These interventions aim to restore balance and harmony within the individual. Acupuncture, particularly auricular acupuncture, has been found to be effective in reducing cravings and withdrawal symptoms. Indigenous cultures, such as Native American tribes, often approach addiction treatment through a cultural and spiritual lens. Healing practices may involve ceremony, prayer, and community involvement. The use of sweat lodges, for example, is a purification ritual that can be part of the recovery process. Such treatments emphasize connection with one's culture, community, spirituality, and the natural world as central to healing from addiction. In South Asia, especially within India, the treatment of addiction also includes a mix of modern and traditional methods. Yoga and meditation are often prescribed as a part of the recovery process for their calming effects and their ability to increase self-awareness and self-discipline. Alongside these, Ayurvedic medicine uses herbal remedies and specialized diets to cleanse the body and mind from the toxins associated with substance use. In many Middle Eastern and Islamic countries, addiction treatment is shaped by religious beliefs and societal norms. For instance, addiction is often seen as a moral failing rather than a medical condition. Treatment methods may include faith-based counseling and religiously motivated rehabilitation centers that enforce abstinence. Social stigma associated with drug use often influences the availability and approach to treatment in these regions. Latin American treatments for addiction often feature community and family involvement. Treatment centers, known as Centros de Integración Juvenil, focus on reintegration into society alongside medical and psychological services. Herbal remedies and religious or spiritual guidance are also commonly integrated into treatment programs. The supportive role of the extended family and the community is seen as essential to the recovery process. African approaches to addiction treatment reflect the diversity of cultures within the continent, often blending Western methods with traditional healing. Rituals, herbal remedies, and community healing ceremonies are frequently utilized. Understanding and treating the spiritual aspects of addiction is common, and healers or shamans may be involved in the recovery process. However, there is also an increasing presence of Western-style rehabilitation centers in urban areas. In many parts of Southeast Asia, addiction treatment methods are influenced by both Buddhist philosophy and Western medical practice. Mindfulness meditation is commonly taught as a technique to manage cravings and urges, fostered by the cultural belief in mindfulness as a path to enlightenment and self-control. Thailand's Thamkrabak Monastery is renowned for its strict drug rehabilitation program, which includes herbal medicine, steam baths, and a vow of abstinence that carries deep religious significance. In conclusion, addiction treatment methods differ significantly across cultures, influenced by historical, spiritual, and societal factors. While some cultures embrace medical and psychotherapeutic interventions, others rely on holistic, spiritual, or community-based approaches. The diversity of treatments reflects the complexity of addiction and the need for individualized care. Understanding these cross-cultural approaches can provide a broader perspective on potential treatment options and contribute to more effective, culturally sensitive recovery programs worldwide. 8.5 Philosophical Views on Free Will and Addiction. When examining the concept of addiction, it becomes vital to consider the philosophical debates surrounding free will. Free will can be defined as the ability to choose between different possible courses of action unimpeded. The question that arises is whether individuals with substance addiction retain free will, or whether their capability to choose has been compromised by the substances to which they are addicted. This debate is long-standing and remains a controversial topic in both philosophy and addiction sciences. Philosophers have taken different positions on free will. Some who are known as determinists argue that free will is an illusion and that all events, including human actions, are determined by preceding events in accordance with the natural laws. This view suggests that once an individual begins the cycle of addiction, their actions are predetermined by the complex interplay of biological, environmental, and neurological factors that are ultimately beyond their control. Others, who are called compatibilists, propose that free will is not incompatible with determinism. They suggest that even if our actions are determined by prior causes, we can still have free will if we act according to our own motivations and desires without external compulsion. In terms of addiction, this implies that individuals have the power to seek and decide to enter recovery, despite the deterministic factors that may influence their addiction. Contrasting both these views are the libertarians, not to be confused with the political group, who argue that free will is incompatible with determinism and that individuals have the capacity for true freedom in deciding their actions. From a libertarian perspective, a person with a substance addiction has the inherent ability to choose not to engage in addictive behaviors, although they may find this incredibly challenging without assistance. The disease model of addiction is another facet to consider in this discussion. This model posits that addiction is a chronic disease that alters brain structure and function. It suggests that due to these changes, the substance user's ability to exercise free will is significantly reduced. The disease model parallels the views of determinism in this sense. In contrast, the moral model of addiction places responsibility for addiction on the individual's choice and personal moral failings. This model leans heavily on the notion of free will, suggesting that individuals choose to engage in substance use and therefore can choose to disengage from it. Critics argue that this model fails to account for the complexities of addiction and can lead to stigmatization and inadequate treatment. An understanding of free will in the context of addiction also has significant implications for recovery. Recovery models that emphasize personal responsibility, such as the 12-step program, pivot on the individual's ability to make a conscious decision to remain abstinent. These models support the notion that despite the factors that contribute to addiction, individuals retain the capacity for making free choices about their behaviors. Philosophically speaking, the existentialist approach to free will suggests that individuals are free to create meanings for their lives despite their circumstances. In terms of addiction, this may empower individuals to define their recovery as a personal mission, transcending the limitations that addiction may impose on their free will. The debate on free will and addiction also raises important ethical questions, particularly in the context of treatment and legal systems. Questions arise as to whether individuals with addiction should be held fully accountable for their actions, or whether the recognition of compromised free will should inform a more compassionate and rehabilitative approach. Lastly, it is imperative to note that the philosophical discussion on free will has practical applications. How we understand and implement policies, treatment programs, and support systems for those struggling with addiction is influenced by our philosophical stance on free will. Thus, the dynamic interplay between philosophy and the lived experiences of those with addiction is crucial in shaping responses to addiction within societies. The philosophical perspectives on free will and addiction offer diverse interpretations of the relationship between an individual's ability to choose and the compulsive nature of substance use. As we further our understanding of addiction through scientific study, the philosophical examination of free will continues to provide an essential framework for ethical considerations, treatment approaches, and the support of individuals in their journey towards recovery. 8.6 The biology of dependence and withdrawal. Addiction, dependence, and withdrawal are interrelated concepts that play a crucial role in understanding substance use disorders. Dependence arises when an individual's body adjusts to the presence of a drug, leading to physiological changes that expect the consistent presence of the substance. As this dependence intensifies, the body's adaptation can result in withdrawal symptoms when the substance is reduced or no longer ingested. The biology behind dependence and withdrawal is complex, involving multiple systems within the body, including neural pathways, neurotransmitter systems, and hormonal responses. When discussing the biologic process of dependence, two key terms often arise: physical dependence and psychological dependence. Physical dependence refers to the body's habituation to a drug, wherein normal functioning begins to require the drug's presence. This physical need is often marked by tolerance, a state where increased amounts of the drug are required to achieve the initial effects once received at lower dosages. Psychological dependence, on the other hand, involves emotional and mental preoccupation with obtaining and using the drug. Cravings, obsession with the drug, and continued use despite negative consequences are hallmarks of this aspect of dependence. Neurotransmitters are chemical messengers in the brain and are critical in the development of drug dependence. Certain substances mimic the action of neurotransmitters or alter their levels within synaptic clefts, the spaces between neurons. For example, opioids bind to opioid receptors in the brain, mimicking the effects of naturally occurring pain relief chemicals. With repeated use, the brain's production of these neurotransmitters may decrease, increasing the body's reliance on the external substance to maintain normal function. This neurochemical change is one of the factors leading to the state of physical dependence. The brain's reward system is another significant player in the development of dependence. Drugs of abuse typically increase the release of dopamine, a neurotransmitter associated with pleasure and reinforcement in the brain's reward pathways. This surge of dopamine reinforces the drug-taking behavior, making the individual more likely to repeat the activity. Over time, the brain may reduce its sensitivity to dopamine or alter its production, making it harder for the individual to experience pleasure from naturally rewarding activities. This diminished response can drive the continued use of the substance to regain the once easily attainable sense of reward. Withdrawal symptoms can vary widely depending on the substance being used, the duration and intensity of use, the method of drug administration, and individual differences in metabolism and physiology. These symptoms can be physiological, such as shaking, nausea, and headaches, or psychological, such as anxiety, irritability, and depression. The onset and duration of withdrawal also depend on the substance. For example, withdrawal from opioids can begin within hours of the last dose and last for several days, while withdrawal from benzodiazepines can take longer to manifest and may persist for several weeks. To understand the biological underpinnings of withdrawal, it is essential to consider homeostasis, the body's natural state of balance. The introduction of substances can disrupt this balance, prompting an adaptive response from the body to maintain equilibrium with the drug present. Upon cessation of the substance, the body must readjust to function without it, leading to the symptoms of withdrawal. This physiological process is marked by the reversal of adaptations the body had made to accommodate the drug, which includes changes in neurotransmitter activity, receptor density, and signaling pathways. Genetic factors can also influence the development of dependence and the experience of withdrawal. Studies have shown that certain genetic markers may predispose individuals to become more rapidly dependent on substances or to experience more severe withdrawal symptoms. These genetic variables contribute to the complexity of treating substance use disorders, as they affect how individuals respond to different medications and therapeutic approaches during recovery. The process of dependence and withdrawal has extensive implications for the treatment of addiction. Understanding the biological basis of these phenomena is key to developing effective treatment strategies. Medication-assisted treatment, MAT, is one approach that considers the biological aspects of addiction. For example, drugs like methadone and buprenorphine are used to reduce opioid withdrawal symptoms and cravings by partially activating opioid receptors without producing the same high, facilitating a smoother transition to abstinence. Cognitive behavioral therapies also address the biological components of addiction. These therapies work on the premise that learning processes affected by drug abuse can be modified. By teaching individuals to recognize and alter behavior patterns, it is possible to reshape the neural circuits that have been altered by drug use. This approach is holistic, addressing both the biological and psychological elements of dependence. Lastly, the study of dependence and withdrawal is ever evolving. Advances in neuroimaging technology and pharmacology continue to shed light on the underlying biologic processes. By integrating knowledge from basic science research with clinical practices, healthcare professionals can better manage the complexities of addiction treatment. Understanding the biological underpinnings is critical for the development of novel therapies that can more effectively alleviate withdrawal symptoms and promote long-term recovery. 8.7 Chemical Dependency: How Substances Hijack the Brain. Understanding chemical dependency begins with the recognition of the brain as a complex command center that regulates all body activities. The brain is made up of billions of neurons, interconnected in networks that communicate through chemicals known as neurotransmitters. In a healthy brain, these neurotransmitters attach to neuron receptors, triggering a series of cellular reactions that result in various feelings and behaviors. The alteration of this system can significantly affect mood, sensation, and decision-making processes. Drugs of abuse exploit the brain's natural reward system, resulting in chemical dependency. The natural reward system is vital for survival, as it reinforces behaviors linked to pleasure, such as eating and procreation, by issuing the neurotransmitter dopamine in certain brain regions. When dopamine binds to its receptors, it signals pleasure, teaches the brain to repeat the behavior, and forms a memory of the experience. The introduction of addictive substances can hijack this system, flooding the brain with dopamine far more than natural rewards do. This unnatural dopamine surge results in an intense feeling of euphoria, encouraging the user to repeat drug consumption. Repeated use of addictive substances leads to changes within the brain's reward system. Specifically, neurons may respond by reducing the number of available receptors for neurotransmitters, diminishing their sensitivity over time. This adaptation can blunt the user's ability to experience pleasure from not only the drug, but also everyday activities. Consequently, the desire to use drugs can become a driving force in the user's life, with the pursuit of drugs replacing other healthy activities due to the distorted reward system's priorities. Drug tolerance is another critical factor in the development of chemical dependency. As the brain adjusts to the presence of the drug, users find that they require larger doses to achieve the same level of euphoria, a condition known as tolerance. As drug use escalates, it can lead to physical dependence, where the body becomes so accustomed to the drug's presence that it struggles to function normally without it. Abrupt discontinuation of the substance can cause the user to experience withdrawal symptoms, a clear indication of physical dependency. Withdrawal symptoms can vary widely depending on the substance, duration of use, and individual differences, and they may include physical symptoms like nausea, tremors, or seizures, as well as psychological symptoms such as anxiety, depression, or irritability. These unpleasant symptoms create a compelling motivation to resume drug intake to relieve distress. This cycle is a defining characteristic of addiction and presents a significant hurdle in overcoming chemical dependency. The brain's adaptability, or neuroplasticity, indirectly allows for the possibility of addiction recovery. Although the brain's changes resulting from substance abuse can be profound and long-lasting, the potential for reversal or mitigation also exists. Recovery from chemical dependency involves various strategies aimed at restoring the brain's balance and reinforcing behaviors that do not include drug use. This can take considerable time, as changes to brain chemistry and function have to be carefully and gradually reversed to avoid further harm. Behavioral therapy is a component of addiction treatment that aims to help individuals develop strategies to cope with cravings and avoid cues that trigger drug use. This therapy also seeks to rebuild or establish healthy reward pathways so that individuals can find pleasure and motivation in activities not related to their substance of choice. Cognitive behavioral therapy, CBT, for example, assists individuals in recognizing, avoiding, and coping with situations that may lead them to abuse drugs. Pharmacotherapy can also play a role in treating chemical dependency. By utilizing medications that act on the same neurotransmitter systems as the misused substances, treatment can often alleviate withdrawal symptoms and reduce cravings. These medications can mimic the effects of the drugs at safer levels or block their effects altogether, reducing the rewarding sensation associated with drug use. For example, methadone and buprenorphine are used for opioid dependency, while naltrexone can be used for both opioid and alcohol dependency. The effectiveness of addiction treatment is often enhanced by addressing co-occurring mental health disorders, such as depression or anxiety. Many individuals with chemical dependency also struggle with mental health issues that may have contributed to or resulted from their substance use. Integrated treatment plans can bring about significant improvements by simultaneously targeting both the addiction and any underlying psychological disorders. Long-term recovery frequently requires sustained support and maintenance. Recovery from chemical dependency is not typically an event, but a continuous process that can last a lifetime. Support groups, ongoing therapy, and careful attention to maintaining a balanced lifestyle can support individuals in remaining drug-free. It is important to recognize that relapse can be part of the recovery journey, not a failure, but rather an opportunity to learn and recommit to the recovery process. Chemical dependency involves the compulsive use of substances due to changes in the brain's reward system resulting from drug abuse. Overcoming this dependency is challenging but possible, requiring a comprehensive and individualized approach that often includes behavioral therapy, pharmacotherapy, treatment of co-occurring disorders, and long-term support. As research on addiction and recovery advances, new tools and a greater understanding can lead to more effective ways to help individuals struggling with substance use disorders regain control and improve their quality of life. 8.8 Narratives of Overcoming Addiction. Overcoming addiction is a complex and multifaceted process that varies considerably from person to person. Narratives of overcoming addiction can provide valuable insights into the nature of addiction, the recovery process, and the myriad strategies that individuals employ to achieve and maintain sobriety. These personal stories can offer hope to those who are still struggling, help destigmatize addiction, and serve as educational tools for both the public and healthcare professionals. Recovery from addiction typically begins with an individual's recognition of the problem, which is often followed by a decision to seek help. This help can take various forms, including professional treatment, self-help groups, or a combination of methods. A pivotal point in many recovery narratives is the moment of realization when the person understands the severity of their addiction and its impact on their life and the lives of those around them. The next step in recovery often involves detoxification, which is the process of allowing the body to rid itself of the addictive substances. Detoxification can be dangerous if not conducted under medical supervision, due to the potential for serious withdrawal symptoms. After detox, individuals usually engage in a structured treatment program that may include therapy, counseling, and education about addiction. A key factor in successfully overcoming addiction is the development of coping strategies to deal with cravings and potential relapse triggers. These strategies might include identifying and avoiding situations that increase the risk of substance use, adopting healthy habits, or learning stress reduction techniques. Many recovery narratives highlight the importance of developing a strong support system, which may consist of family, friends, or individuals from recovery communities, such as Alcoholics Anonymous or Narcotics Anonymous. In the process of recovery, individuals often go through a period of self-reflection and work to address the underlying issues that may have contributed to their addiction. This introspective phase can include therapy sessions that facilitate understanding past behaviors, improving emotional regulation, and fostering a sense of self-worth. Recovery stories frequently discuss the transformative power of this self-awareness and the personal growth that emerges from it. Another common theme in narratives of overcoming addiction is the concept of hitting rock bottom. This term refers to the point at which an individual's addiction causes such significant consequences that there is no denying the need for change. The experience of hitting rock bottom can be a catalyst for seeking recovery, but it is crucial to acknowledge that not everyone needs to reach this point to make meaningful changes in their lives. Maintaining sobriety demands ongoing effort and vigilance. Many who share their stories of overcoming addiction describe it as a lifelong journey rather than a destination. They often continue to attend support meetings, work with a sponsor, or otherwise engage in activities that reinforce their commitment to recovery, underscoring the enduring nature of the work involved. One of the benefits of sharing recovery narratives is the capacity to inspire others. These stories often include strategies that have worked for individuals, which can be adapted by others in their own paths to recovery. They commonly emphasize patience and resilience and may also address setbacks such as relapse, offering perspective on how to recover from such challenges and continue the journey toward wellness. An integral component of many recovery stories is finding purpose and meaning beyond addiction. Those who have overcome addiction often report that engaging in meaningful work, pursuing hobbies, volunteering, or helping others with their recovery can fill the void that was once occupied by substances. This sense of purpose can be a powerful motivator and source of satisfaction in the recovery process. Lastly, recovery narratives serve as a testament to the possibility of change. They confront the stigma surrounding addiction by demonstrating that individuals who struggle with substance use disorders are capable of transformation and redemption. By sharing their stories, those who have overcome addiction contribute to a dialogue that can change societal perceptions and encourage others who are facing similar challenges. Narratives of overcoming addiction are multifaceted, with each story offering a unique perspective on the journey to recovery. While the path to overcoming addiction is arduous and individualized, the shared experiences of struggle, growth, and hope serve as a reminder that recovery is possible and that those who have gone through it are not alone. Such narratives reinforce the need for comprehensive support systems and patient, individualized approaches to addiction treatment. 8.9 Rehabilitation, Methods and Efficacy. Addiction rehabilitation is a structured process designed to help individuals overcome dependence on drugs or alcohol. The primary goal of rehabilitation is to enable individuals to achieve lasting sobriety and improve their overall quality of life. Rehabilitation programs can vary widely in their methods, settings, and duration, but most include a combination of medical, psychological, and social interventions. The efficacy of these programs depends on multiple factors, including the type of substance involved, the duration and severity of the addiction, the presence of co-occurring disorders, and the motivation of the individual seeking treatment. Detoxification is typically the first step in rehabilitation and involves purging drugs or alcohol from the body. Medical supervision during detox is crucial, as withdrawal can be dangerous and even life-threatening in some cases. Medications may be employed to manage withdrawal symptoms, reduce cravings, and treat any co-occurring mental health issues, such as depression or anxiety. This phase can last from a few days to several weeks, depending on the substance and the individual's physical dependence. Following detox, the focus of rehabilitation shifts to therapy and behavioral interventions. Cognitive behavioral therapy, CBT, is a common therapeutic approach used in addressing addiction. This form of therapy helps individuals identify and challenge negative thought patterns and develop healthier coping strategies. It is evidence-based and has been shown to be effective in both individual and group settings. Therapy sessions can provide individuals with the skills needed to resist relapse, address triggers, and make significant behavioral changes. Another critical component of rehabilitation is education. Participants often learn about the science of addiction, including how substances affect the brain and body. Understanding the biological underpinnings of addiction can demystify the experience and support the recovery process. Education also encompasses strategies for maintaining sobriety, such as stress management, time management, and problem-solving skills. Educational sessions might also include information about the potential health consequences of continued substance use. Peer support plays an integral role in rehabilitation through group therapy and mutual support groups, such as Alcoholics Anonymous, or Narcotics Anonymous, NA. The shared experiences of peers can provide valuable insights and foster a sense of community and understanding. The social support from these groups can be particularly beneficial during and after the formal treatment process. The encouragement and accountability provided by peers often strengthen an individual's commitment to recovery. Behavioral interventions frequently include family therapy, which involves the addict's family members in the rehabilitation process. Addiction can significantly impact family dynamics, and involving family in therapy can help repair and strengthen relationships while providing additional support for the person in recovery. Addressing the entire family system can also help prevent substance use by other family members and create a more stable home environment conducive to lifelong recovery. Long-term follow-up care is essential in maintaining sobriety after the completion of a rehabilitation program. Aftercare may involve ongoing therapy, support group meetings, and sometimes sober living arrangements. This continuum of care helps to prevent relapse and ensure individuals have access to support during challenging times. Monitoring and intervention can continue for months or even years after initial treatment, emphasizing the chronic nature of addiction. The setting of rehabilitation can be either inpatient or outpatient. Inpatient or residential rehabilitation programs require individuals to live at the treatment facility, providing a controlled environment, structured daily routines, and round-the-clock access to care. Outpatient programs allow individuals to live at home and maintain a degree of normality in their lives, attending therapy and treatment sessions at scheduled times. The choice between inpatient and outpatient care is influenced by several factors, including the severity of addiction, the presence of other medical or psychiatric conditions, and the patient's home environment. The effectiveness of rehabilitation programs is measured in various ways, including rates of abstinence, reduced drug use, improved physical and mental health, better social functioning, and reduced criminal activity. Outcome studies indicate that while relapse is common, many individuals achieve long-term recovery with appropriate treatment. However, the success of rehabilitation is not solely determined by the type of program, but also by the individual's level of engagement, the competence of the staff, and the quality of aftercare services. Tailoring rehabilitation programs to the needs of the individual is critical for their success. This may include considerations of cultural background, gender, age, and socioeconomic status. Specialty programs have been developed for various populations, such as adolescents, women, individuals with dual diagnoses, and members of the LGBTQ+ community. Providing such individualized care increases the relevance and effectiveness of treatment interventions. Overall, addiction rehabilitation can be highly effective, but it is not a one-size-fits-all proposition. A combination of medical treatment, therapy, education, peer support, and family involvement, along with a strong aftercare plan, forms the foundation of successful rehabilitation. Recovery is a journey that requires time, patience, and dedication, but with the right resources and support, individuals can overcome addiction and lead fulfilling, sober lives. Each person's path to recovery will be unique, but the underlying principle of comprehensive, integrated care remains consistent across successful rehabilitation methods. 8.10 The role of law in drug rehabilitation. The legal framework that surrounds drug rehabilitation is multifaceted, serving to both enable and sometimes hinder the process of rehabilitation. This chapter will explore how laws and legal bodies impact rehabilitation programs and the recovery journey of individuals with substance use disorders. Throughout the chapter, we will consider the delicate balance the law must maintain in promoting public health and safety, while also ensuring the rights and best interests of individuals seeking recovery. Law enforcement is often the first contact individuals with substance use disorders have with the legal system. Police officers have the discretion to arrest individuals for drug-related offenses or to refer them to treatment programs, depending on the jurisdiction's policies. The recent trend towards treatment over incarceration for nonviolent drug offenders illustrates a shift in the role of law enforcement. This shift is often facilitated by law, such as drug courts, that provide alternatives to traditional incarceration, aiming to address the underlying issues of addiction. Drug courts are specialized court docket programs that target criminal defendants and offenders, juvenile offenders, and parents with pending child welfare cases who have alcohol and other drug dependency problems. These courts are designed to reduce recidivism and substance abuse among participants, and to increase the likelihood of successful rehabilitation through early, continuous, and intense judicially supervised treatment. The success of drug court programs significantly depends on the partnership between the judiciary, prosecutors, defense attorneys, community correction agencies, drug treatment service providers, and law enforcement officials. Civil commitment laws in some jurisdictions also play a critical role in the rehabilitation process. At times, individuals struggling with severe addiction may be unable to seek help on their own and may pose a danger to themselves or others. These laws allow for the involuntary commitment of such individuals for a period of treatment, with the intention of providing help in a controlled environment. While such laws are contentious due to concerns about civil liberties, their aim is to provide urgent assistance to those in a crisis state of addiction, often as a last resort. Rehabilitation is further influenced by legal access to medication-assisted treatment, MAT, such as methadone or buprenorphine, for opioid addiction. Regulations regarding the administration and prescription of these medications are crucial in combating the opioid crisis. Laws and regulations that improve access to MAT can significantly advance recovery by providing evidence-based treatment options to those in need. However, strict regulations may also limit the availability and efficacy of these treatments, showcasing the critical balance that the law must maintain in providing access while preventing misuse. Employment laws have a significant effect on recovery by addressing workplace policies related to substance use and protecting the rights of workers seeking treatment. The Americans with Disabilities Act, ADA, prohibits discrimination against individuals who are in recovery from addiction and have a history of substance use disorder. Employers are also encouraged to provide reasonable accommodations, such as allowing time off for treatment. By safeguarding the employment rights of those in recovery, the law helps facilitate reintegration into society and provides an essential support structure for ongoing rehabilitation. Healthcare laws, including parity laws and the Affordable Care Act, ACA, impact drug rehabilitation by dictating insurance coverage for treatment. Parity laws require insurance policies to provide coverage for mental health and substance use disorder treatments at levels equal to those for other medical conditions. The ACA expands this by requiring most insurance plans to cover substance use disorder services, which broadens the availability of treatment to individuals who may not have otherwise been able to afford it. Zoning laws and community regulations intersect with drug rehabilitation through their control over the location and operation of treatment facilities. While treatment centers are necessary for recovery, they may sometimes face opposition from communities due to stigma or concerns about safety. Laws play a pivotal role in determining where and how these facilities can operate, ensuring that facilities are accessible to those in need while balancing the concerns of the community. The establishment of clear and fair zoning regulations is crucial to the development and functioning of rehabilitation centers. Criminal laws regarding possession and substance use have significant implications for the recovery process. Harsh penalties for drug possession can lead to a cycle of incarceration that may interrupt or prevent effective rehabilitation. Conversely, decriminalization efforts aim to reduce the stigma associated with substance use disorders and shift focus towards treatment rather than punishment. The legal system's approach to drug-related offenses continues to evolve as more is understood about addiction and the effectiveness of rehabilitation over punitive measures. The law plays a vital role in shaping the landscape of drug rehabilitation. From the enforcement practices of police to the operation of drug courts, civil commitment statutes, employment protections, healthcare policies, and zoning laws, legal frameworks influence the availability, access, and quality of treatment services. As the understanding of addiction continues to grow, the legal system must adapt to support recovery and promote the health and well-being of individuals with substance use disorders and their communities. Legislators, legal professionals, and policy advocates must continue to engage in dialogue and reform efforts to optimize the role that law plays in drug rehabilitation.